U.S. is still waiting for approval from the Food and Drug Administration for a COVID-19 vaccine. Governor Gavin Newsom recently saying that by next week, vaccines should be arriving to California. 23 ABC's Alex Bell has more details on the status of the county's COVID-19 vaccination plan and when one doctor thinks we could see a return to normal life.
When you tally how many overall healthcare workers we have, we don't have the final number of the shipment that we are expecting, but we don't believe it will be adequate to cover all of the healthcare workers, that this will be a phased-in approach. This is the first shipment.
Michelle Corson with Kern Public Health says the county health department is working with local hospitals to receive the shipments, and residents should be prepared to receive new information about vaccines and the process over the next several days as details continue to be finalized from the state. Health officials hope the vaccine will create herd immunity. Dr. Elaine Batchelor, who is the chief executive officer of Martin Luther King Jr. Community Hospital, says the vaccines will also be effective and help slow the spread, but also adds that there is not enough data yet to determine if the vaccines will prevent transmission of the virus.
What we've seen is that it prevents people from getting seriously sick with COVID, but we don't have enough data yet to know whether it actually prevents transmission. They're still studying the vaccines, so we will get that information eventually, but when they first roll out, we won't know that, so people will need to continue to mask and socially distance, even after they've had the vaccine, at least for a little while.
So when can we expect to return to normal life? Well, according to Batchelor, a community effort is key.
I think that we will be in very good shape by the fall of next year.
Batchelor adds that so far data shows the vaccines are safe, but recipients will be monitored for additional rare side effects, adding that most of the side effects are like fevers, headaches, aches, and pains. And when asked what are some of the most serious side effects, she says there are some theoretical concerns, just like with any new vaccine, but they are unlikely to happen.
The side effects that we're talking about, which have not been seen in any of the trials, would occur if your body reacts too vigorously to the vaccine or to the virus, and you end up with damage to your own tissues from your own immune response. And that's something that's rare.